Hello and good evening, everyone. Welcome to my Evi Fences, and it's great to have you here. Evi Timotheou is with us. So, hi, Evi. How are you? It's great to have you back as our presenter tonight.
Hi, Caroline. Nice to see you again.
Thank you so much. We are connecting to Thessaloniki tonight, and Evi will talk about IVF add-ons, which is a topic that I know that we talked about this before, but I think that still we need to discuss it. And of course, Evi is the best person to explain what IMSI, PICSI, MACS, Embryo Monitoring, EmbryoGlue, what are those things and when they are indicated. Evi is the lab director, but also senior embryologist at Assisting Nature, which is located in Thessaloniki. So she's the best person to do so. So welcome to our webinar. Remember, we will start with Evi's presentation, but after that, there will be time for your questions. So if you have any prepared, you can put those in the chat right now, but of course you can do it later as well. And before we start with our presentation, as always, I would like to say thanks for joining us tonight, but also add that European Fertility Society is proudly supported by PhenoMatch, which is the face matching tool that can help you with finding a donor. So thanks a lot for that. And as always, I would also like to add that we are still looking for volunteers. So if you up for it, if you know someone that might be interested, please get in touch with me. I'm your host, Caroline, and if you get in touch with me, I will be able to tell you what we are looking for. Right now, we are focusing on transcriptions. So if you think that this is something you could help us with, get in touch with me. I'll be happy to give you more details. And also, if you wish to support European Fertility Society and my Evi Fences, you can donate. Just go to our website. The link is in our chat section, and that way you can, of course, help us out as well. And this is my short introduction, but of course, I would love to start our presentation. Evi, are you ready to go ahead with the presentation?
Yes, of course.
Brilliant. Let's go ahead then, of course. Here's your presentation. Thank you.
So, good evening to all. I would like to thank you for the invitation once again. And I hope to help the couples with my presentation. And I would like to talk about some techniques that we use in the lab. There are several techniques that we can utilize for having a successful result. The most common techniques used for this purpose are the use of IMSI, PICSI, MACS, assisted hatching, embryo monitoring, and embryo glue. And let's talk about them. So, we start with the intracytoplasmatic morphologically selected sperm injection IMSI, it's called. Then we will see about PICSI, MACS, assisted hatching, embryo monitoring, and embryo glue. So, about the IMSI techniques. It's a method that allows the intracytoplasmatic sperm injection of morphologically selected sperm. The sperm image is maximized up to 6,600 times and allows the embryologist to choose only the ones which are the healthiest and have the best morphology. Finding from IMSI imaging helps to discard spermatozoa with mitochondrial dysfunction or having a DNA damage, and helps to identify spermatozoa with a normal nucleus and nuclear content. IMSI can contribute to improving the success rates of patients who appear to have bad sperm morphology and are diagnosed with oligoasthenoteratozoospermia. According to studies, it has been shown that this particular method can lead to better fertilization rates, better embryo quality, and as a consequence, of course, better pregnancy rates. So, in addition, IMSI is a useful technique for couples with unexplained infertility or couples with repeated implantation failures. Here in the image, you can see how can magnify a sperm. So this on the left is without the high magnification. And on the right, we can see how is magnified the sperm, and we can see if it is a perfect spermatozoa or not. Another technique which offers also the sperm selection is the PICSI technique. The PICSI is named as a physiological intracytoplasmic sperm injection. Offers a new assessment criteria for sperm selection, as it is based on the ability of the sperm to bind the hyaluronic acid. Specifically in this method are used Petri dishes, as we can see down on the right, which contain special culture media with hyaluronic acid. When sperm sample is added to the dish, only spermatozoa with the best quality bind to the acid, and as a consequence, are chosen by the embryologist to do the microfertilization. The principle of this method is based on the fact that the hyaluronic acid naturally occurs in the substance that surrounds the oocyte and plays a critical role in the sperm-oocyte fusion. Therefore, spermatozoa which appear to have the ability of binding with the hyaluronic acid are supposed to be mature and to have less chromosomal abnormalities. This method is useful in cases of repeated implantation failures, of recurrent miscarriages, and sperm with having a high rate of sperm DNA fragmentation. So we can finish with another technique, MACS technique, which is based also selective to select sperm, which is the MACS method. This method is based on the immune magnetic separation and selection of good quality spermatozoa, capable of fertilizing the oocytes and removing apoptotic spermatozoa, those which will die without achieving fertilization. We can see on down on the right a little bit the method, how it proceeds, and is based on the use of magnetic nanoparticles which have surface-specific antibodies to recognize and adhere the apoptotic-only spermatozoa. The sample then passes through a magnetic filter that binds the apoptotic sperm while allowing it to pass the normal one. So this method is useful in cases of couples with poor, of course, embryo quality, as well as couples that confront recurrent miscarriages, or when the man is diagnosed with subfertility and has a high rate of sperm DNA fragmentation. Let's look about the assisted hatching, which is a technique that we use in oocytes or in embryos. This technique is sometimes used, is usually used in assisting reproduction more often. Shortly before the embryo transfer, the embryologists do a small opening or a thinning in the zona pellucida of the embryo using a special laser. Here we can see the thinning that we do with the laser. And this technique of assisted hatching is recommended in cases where the zona pellucida of the embryo is believed to be thick and stiff to prevent implantation. This helps the release of the embryo from the zona pellucida and its implantation. Assisted hatching is also used for those patients who have had 2 or more failed cycles in the past. And usually we use very often this method of assisted hatching in couples that the woman's age is over 40 years old. about embryo monitoring, I think that all the units, the IVF units, they use these time lapse, these incubators, because embryo monitoring is a continuous tracking of in vitro development of embryos. Thanks to a video recording, we can determine which embryo develops normally. We choose the best suited embryo for transfer, which has the greatest chances of developing into a healthy baby. Another added advantage of this imaging system is that we can view the embryos continuously. We can look them at 24 hours a day without the need to remove them from the warm and the stable condition of the incubator. Another useful tool is the Embryo Glue. It's not actually a glue, but it acts like a glue by increasing the chance of implantation of the embryo to the womb. It consists of a high concentration of hyaluronan and recombinant human albumin, both of which promote implantation. Embryo glue, we can say that mimics the natural environment in the womb. Nutrients and energy substrates in embryo glue are adapted to the embryo needs at the time of implantation to mimic nature as much as possible. We can say that embryo glue has been used clinically since 2003. And as a conclusion, we can say that using this method I mentioned before, we can improve the fertilization rate after PICSI. We can improve the embryo quality, increase the blastulation rate, which is important. Of course, increase the implantation rate. And finally, increase the pregnancy rate. But our purpose using all these techniques, other than just having a good rates, is to help to take home a healthy baby. So we can say there are also other techniques that we can use. This is the most common that we can say. And I think that we can say that we see all the couples and their problems, and we use they're just one for them. So I would like to thank you for your attention, and I hope to find it very useful as a presentation.
Hi, Evi. Sorry, I'm right
Hi,
here.
Caroline.
Thank you so much for explaining all those techniques that are used in the lab. You are more than well familiar with all of those. And now, of course, it's time for your questions. So go ahead. If there's anything that is not clear for you, or if there's anything that you would like to ask Evi, she's the senior embryologist, so she has been in the field. She already told me just before we started, like for 17 years, so she has great experience and she's right here for you. So if you have any questions, this is your time. Go ahead. You can ask, of course, any questions on this all those techniques mentioned by Evi, but also if there's anything you would like to ask an embryologist, this is your time. Go ahead and do it. We don't have any questions yet. That's why I'm encouraging anyone that might want to ask anything. This is your time. And this is the first question that we've got. So that's from Lisa. So just give me a second. Thank you, Lisa, for your first question. Thank you for your presentation. Can you use embryo glue at the same time as assisted hatching? Thank you in advance.
Yes, we can use it because when we do assisted hatching, we do it some hours before, not in the last time, and we can use it. Yes.
So it's not a problem to use both at the same time, of course. Okay, good. Thank you, Lisa, for your question. We need to wait a bit. Someone is typing. I believe there is another question, so let's give it a minute, and I'm sure there will be some more questions. And of course, Yeah, sorry, I just thought that we did have another one, so let's give it a second. Yeah, not yet. Let's give it a few more minutes, possibly. There's another question from Belinda. Let's have a look. I've just had 5th transfer that didn't work. It was frozen embryo transfer. My clinic did not think highly of assisted hatching, but now I'm waiting for review next week, so hoping we can suggest together something else to try. We have 6 frozen untested blastocysts to try.
Yes, I think depends also the age of the woman, but I think after a frozen thawing the embryos, we have a hardening of the zona pellucida, so we think that it's better to having an assisted hatching and help the embryo to goes out from the zona.
Okay, understood. Belinda has added sorry, just a second. I'm 43, sorry. The blastocysts were made when I was 42 and 43.
We suggest also to do the pre-implantation genetic diagnosis in this age. It's better.
It's
Now,
definitely
yes,
recommended to go
we
ahead with it.
recommend it.
Okay. And so is there like a cutoff age, or at what age you are, let's say, start to suggest?
Over 40, 41.
This is
Usually over 41, yes, they do directly the testing, the PCD testing.
okay.
Not to
Makes sense.
having the reason is not to having a lot of abortions and to have a better psychological mood.
Of course. Okay, that makes sense. And if I may ask, because sometimes we hear this question, what about egg donation situation? Do you recommend PGTA, or in which
We don't
such cases?
we don't recommend it because usually the donors they are young and we don't find a lot of abnormalities. Then depends also, of course, the sperm quality. But we think that if it is a young oocyte, a good morphology oocyte can help also about the sperm.
Of course. Okay. That makes perfect sense. Thank you so much. I know that this question definitely is asked a lot. So thanks for adding that. And there are more questions coming up. So let me have a look. Maria has another question. Thank you for your presentation. Do you personally use all these add-ons in your lab? Have you indeed see an increase on your delivery rates? Sorry.
So I tried them all. I used them all for a while, but I think assisted hatching increased the delivery rates, and also in embryo monitoring with time lapse that helps the embryo not to be stressed a lot. Also, I must say that in time lapse incubators, we culture all the embryos that goes to do a PGT testing. So we can check the blastocysts when they are ready and not to take them out every half an hour.
Yeah, this is the biggest
Yes,
advantage, I think. Yeah,
yes,
that's possible to just simply monitor
exactly,
the embryos rather than just take them out, etc. So,
exactly, and not to stress them.
okay, good. Thank you so much. What about ERA test? Anything you can add about this particular test?
ERA test it's in a doctor's decision because it's something medical. It's not in the lab. Yes, in our clinic we do it in some cases.
Okay, thank you so much, of course. Okay, Belinda has a follow-up. Okay, so the previous patient, 43. Unfortunately, we haven't done PGT testing because we only made one blastocyst each egg collection. I had done back-to-back, so 10 eggs were collected over approximately into 2 years. Yeah, 10 eggs collected over approximately 2 years.
I hope to be the lucky one. This blastocyst.
Yeah. So, but anything you can say about PGT testing?
Yes, I recommend it over 31 because I think that in an age of 42, in 5 embryos, you can find maximum 2 healthy embryos.
Yeah. Okay. That makes sense, of course. Uh, okay. Sorry, Belinda. Thank you for follow-ups. Yeah. So 10 egg collection procedures. Okay. So 10 egg retrievals. That's what I see here. Only 7 blastocysts were collected. Okay.
Okay.
Yeah. All right. Thank you. Belinda, if there's any follow-up, please go ahead, okay? Because we have more and more questions, and I will be able to, of course, go back to your question. Emma has a question. What does it mean to have 66% of sperm? What can be done in such case?
I think she means with the DNA fragmentation result, if I can understand. That is pathological. Usually they take some vitamins and they suggest doctors to examine again. But I think we can find a healthy sperm to do some blastocysts. It's not the 100%, it's 66.
Okay, so there's always a chance that the
Yes,
rest, it's
yes.
possible to find
Yes,
some.
it's possible to
Okay.
find.
Okay, I believe that was helpful for you, Emma. Thank you for your question. Okay, let's have a look. We have another question from Martina. This is going to be a longer question. I understand embryo monitoring helps to choose the most suitable embryo, but besides that, does embryo monitoring directly increase chances of implantation rate compared to embryos that manage to develop to day 5 in standard conditions due to the better condition for development in embryo monitoring? Especially, does the process of embryo development influence any potential genetic issues, or are those genetic problems genetic problems come directly from egg and sperm, and the development process during the 5 cultivation days don't play a role anymore? Thank you for the question.
So, the embryo monitoring incubator helps not to having outside always the embryos of their let's say natural culture. But we can say that there are a lot of conditions that other the genetic problems that can have can other condition can affect the quality of an egg and sperm, especially when we do the ICSI, the injection. They must have appropriate temperature, or if it is less, we can cause some abnormalities and some aneuploidies if in the lab there are not the standard conditions. Um, about the embryo monitoring, we can choose from the first transfer the best embryo. We can see the best embryo to choose for a transfer. I think we have all the blastocysts. We can transfer them at a good quality, but with the embryo monitoring, we can choose the better one for the first embryo transfer. This is the difference. Not to go on blunt, to see only the last day, the morphology. And in the embryo monitoring, we can see the every minute.
Okay. Thank you again for your question, Martina. I hope that was helpful. I believe so. Thank you indeed, Evi, as well for that. Fran has another question. How much better result could be expected from PICSI using frozen sperm from MTZ with very good DNA fragmentation?
We don't use PICSI with a frozen tese because they are not. It's difficult to find so much sperm to use for a PICSI. Usually, in a frozen sperm from a tese, we look at the morphology if we find some, and we hope to has a good DNA fragmentation. But I think that you say that you have a frozen sperm with a very good DNA fragmentation. we hope with this case to have good results.
Okay, thank you. There's a follow-up from France, so let me just show you. But this will be the last sperm. So after many failures, want to make the most of it.
Okay, but it is very positive that has a normal DNA fragmentation that they don't have.
Mm-hmm.
A normal DNA fragmentation, the sperm from These. This is
Okay.
a good result, I think.
Okay. All right. Thank you, friend. If there's anything else, of course, you know what to do. And let me just see. Yeah. And Fran would like to thank you for your answer with that. Okay, Lisa has another question. What are your thoughts on performing PGTA testing on frozen embryos to defrost them, test them, then refreeze them? I use donor eggs but have had 7 embryos with no signs of implantation. My clinic doesn't recommend testing, but I want to try everything I possibly can.
Okay. I don't recommend this to do it because it is a stress for the embryo to do a first vitrification, then to defrost it, to thaw it, to do a PGD testing, and then to refreeze it. It's a stressful environment for the embryo, and we don't know if it reacts good when we thaw it again for a transfer. So we don't recommend it. It's better to have a decision before freezing it in day 5 to do this technique.
All right. Thank you. Thank you for, okay. Lisa, thank you for this reassurance. For sure. I believe it was helpful then. Thank you so much indeed. I'm waiting for some more questions. Someone is typing again. I see it. So we just need to give it a minute and have a look at the questions. But thanks everyone for asking lots of different questions indeed. Making this interesting for sure, for Evi as well.
Yes.
Although I know this is something that you are doing on daily
Always
basis,
the
right?
questions go to PGTA. Always there. They're going there.
It's always
It's
true.
normal.
It's always it's true. It's something that I think that still needs to be discussed as well, right?
Yes, exactly.
It's been and actually, while we are on that topic, what do you think about that new method, non-invasive PGTA? Have you been able to? Do you have any opinion on that
Yes, we
already?
start to see it also in our clinic,
Okay.
the new, but it's experimental still. We don't have, yes, we must have a lot to do a lot of studies, all the clinics, before they start to do it, because we don't have the same results yet with the PGTA.
Of course.
Better for us a non-invasive, not to harm the embryo, not to stress it, but still it's an experimental, and I hope to in the next 5 years to know
A little bit more.
Yes, a little more. Yes,
Of course. But you are also doing some research, I guess, on that.
Yes, we will
Yeah.
start to, yes,
That's
we start
great.
to see also.
Okay.
Yes.
Thank you so much. So, of course, I'm sure this is a topic that will come back every now and then as this is still investigated. Thank you for answering my additional question. And I'm just waiting. It looks like that is our final question. But of course, if you have anything, remember, you can still ask some questions. But if not, there is also a possibility for you to simply get in touch with Evi, her team at Assisting Nature, and I'm sure they will be happy to help. But in the meantime, we did receive one more question. Can assisted hatching cause any damage to the embryo?
Yes, if an embryologist doesn't know how to do an assisted hatching, can cause damage. But I think that all the embryologists that they do this method, they are capable to do it, and I think all they have good results.
Okay, that's understandable then, of course. Thank you so much. And in the meantime, we did receive one more question from Martina. Does it make sense? And is it possible to combine embryo monitoring and PGTA testing? We tried non-invasive PGTA, but our first 2 transfers with OK embryos were not successful, and our remaining embryos have been graded as lowest category. Our clinic recommends in potential next stimulation to do PGTA. Okay.
Yes. as I said before, non-invasive PGT is still experimental, so we can say that it will. Yes, they seem to be okay, but we're not in 100% that finally they are okay. The invasive method, it's now for now. And yes, I would suggest to do a PGTA in the next stimulation.
To be sure,
To
yeah,
be
to
sure,
be
yes, to see all the chromosomes, to be sure.
okay. That's understandable, I guess, right? So
Yes,
with those new techniques, there are many of those already. Yeah, we could talk about
yes, we
actually.
have
So
still to see a lot of things. Yes,
there are still things that we need to
yes,
simply wait for some more details in order
exactly.
to help out. Okay. Thank you, Martina. I think that again, I hope that you were reassured. PGTA is the next thing to do. And thank you so much. Someone is typing, I don't know whether it's a question or a thank you. So let's give it a second. If it's a thank you, we will be finishing, but I already think it was really useful to have you here, Evi, for reassurance and, of course, answering all those questions. Let's give it a second. One more question here. Does it make sense, and is it possible to combine? Yeah, you
Yes,
already
we
asked
always
about embryo.
combine embryo monitoring with PGTA testing.
Yeah, exactly.
Yes,
So it's definitely fine. It's possible
yes.
to do. So all is clear, I hope. All right, I believe we will be finishing for tonight. So thanks a lot, everyone, for joining, for your questions, and Evi, anything else you would like to add before we finish for tonight?
Okay, I would like to thank you also. I hope to see you soon, Caroline.
Same here, of course. As always, it's a pleasure to have you as our expert. So, everyone, thanks a lot for your questions. Remember, there is an option for you to get in touch with Evi and her team. I'm sure they will be happy to help you out with any other questions that you might have or advice. And tonight, that will be it. But remember, we will be back. There are some more events coming up, and actually, next week not next week, sorry, in 2 weeks' time, on the 8th of November, there is another webinar. We will talk about another still experimental method, PRP. So if there's something, if you would like to know a little bit more on PRP and how it works, etc., and when it's indicated, you can join us on the 8th of November. We'll be back with Dr. Daniel Bodry from IVF Live. So I will be happy to see you there. And once again, thanks to Phenomatch for supporting European Fertility Society. And also, I would like to say thanks to our expert, Evi Timotheou, was our presenter tonight. Thanks, everyone, for joining us. Hope you will have a great evening. And of course, I do believe it was helpful. Evi, as always, a pleasure. I'm looking forward to some more events soon enough as well. Thank you so much.
Have a nice evening. Bye.
Thank you so much as well. Bye.
Bye.